I've been doing this long enough that I remember when kids were first diagnosed as infants, and now you see them in high school and graduating high school,
Right.
and so that's always amazing as well.
Dr. Goldstein, thank you so much for joining us today. You follow the golden rule when it comes to patient care. Could you remind the viewers what the golden rule is and why it's important in your line of work?
Absolutely. So, when I think about the golden rule, it's really around treating the folks who come into my space the way that I would want to be treated, the way that I would want my family to be treated. I think that's essential. Having been in emergency departments for my own care and for families' care, it's a really, really stressful place to be as a patient. We see kids from birth until 23, and most of them come with a family unit. And certainly people who bring their kids to an emergency department are not there because they want to be there. They're there because they're scared. They're there because there's something very significant going on in their lives. And so one has to be attuned to both the emotional needs of your patient as well as the emotional needs of the family unit.
You often have to be as efficient as possible in treating a patient while not being blind to competing diagnoses. How do you go about solving complex cases in limited time?
Yeah, so that's actually, I think, one of the things that we have to remind ourselves all the time, is that, most of the time you can use a paradigm of, a chief complaint and an age of a child can lead you to a diagnosis that usually be the correct diagnosis. When you are seeing an epidemic of flu, every case that comes in that seems to be like the flu-like illness, you need to catch that one case that isn't the traditional flu of the season, but represents something different. And that's what's so keen about being broad enough and mindful enough and picking up the subtleties that come out on both history and the subtleties that you might pick up from your examination to be able to pick out the needle from the haystack. The most unique and amazing aspect of taking care of kids is that every single sort of phase of development, you have different things. There are different physiologic variants, there are different diagnoses to consider, and that's what I love about it. It's from a clinical diagnostic perspective, it creates a layer of complexity, which I think is amazing, and then from a communications perspective, it really does keep us on our toes because we need to be thoughtful about talking to a 5-year-old is different than talking to a 10-year-old, which is different than talking to a teenager.
So you make time to understand the stories and backgrounds of the families that you treat, even in an emergency setting. Why is this essential in clinically excellent care?
I think it's actually even in some ways more essential in the emergency department. Most of the time you don't have an established relationship with folks. Many times we see folks who come back to the emergency department because they actually didn't get their problem solved the first time. And it's not necessarily because of a lack of clinical knowledge of the providers the first time. It's that we didn't understand them, and we didn't understand what their true needs were, and not getting at that prevented us from getting them what they really needed and what they deserved.
We may never know what's coming through that emergency room door, but we can be thankful that Dr. Goldstein will be there to step in. Dr. Goldstein, thank you very much for your time. That was a CLOSLER look.
Thanks so much.